Good day everyone. So today we will be assessing the client's mouth. So first, this procedure involves a thorough inspection to the client's lips, teeth, gums, and oral mucosa to identify problems or infections. So first, we have the objective. So objective is to assess the client mouth structure. Second is to determine infection or diseases. Third is to determine if the client's mouth is functioning, and we have the safety and security measures. So first is we have the hand hygiene. Second, wear proper equipments or tools. Third is proper clothing or wearing. So first we have the pre-procedural preparation. You can introduce yourself to the client and then identify the client's identity and explain what you are going to do and why it is necessary and how can client cooperate and gather the necessary equipments and privacy. So good morning sir. So sir, karon is mag-assess ta sa imong mouth sir. So ako din si Nurse Vic sir. So may I know your name sir?
I'm Clark Algrinalas, sir.
Okay sir. So karon sir, kay mag-assess na sa imong mouth sir. So nalang ko'y mga ipabuhat sa imuha and magsaba lang ka if uncomfortable ka, and just follow my instruction throughout the procedure sir. Okay, let's proceed to the first procedure. So first we need to wear a glove. To prevent infection spread. So after we wear the glove, inquire if the client has any history of the following: lesion or discomfort in the mouth, last visit to the dentist, medication being taken. So, okay sir, mga tanong lang po before kung magsuot sa akong assessment sir. Kanang, ano ba kayo kakabatian nga kasakit sa imong paa o sa imong ngipon sir, sa imong gums?
Wala, sir.
Okay sir, so kano saan din yung last visit sa dentist sir?
Wala. Visit sa din.
Okay sir, so last lang sir, na ba inatumar ng mga tambal para sa sakit sa ngipon or para sa imong mouth lang sir?
Wala.
So the client doesn't have any history of the following: inspect the outer lips for symmetry, contour, color, and texture. Ask the client to pursue lips as if to whistle. Inspect and palpate the inner lips for buccal mucosa, for color, moisture, texture, and the presence of lesion. So karon sir is magsugod na ko sa mga assessment sir. So first is mag-inspect lang ko sa imong lips sir. So parehog lang ko sir. Okay, sir. Okay, that's na. Then next is palihog ko kanang anak sa imong lips nga kanang mura kag mo whistle sir. Sir, then no. Ito na ko lang yung lips sir, ako yung inspect ang inner lips. Sir, okay. So the client's lips is normal with a pinkish color, and it is moist and the texture is good. The next step, inspect the teeth and gums while examining the inner lips and buccal mucosa. Ask the client to remove complete partial denture. Inspect their condition. Nothing in particular broken or worn areas. Sir, mag-inspect lang sa yung teeth o gums sir sa panugo. Ana. So, there are no dentures or any other maladies in the inner lips. And ask the client to remove complete or partial denture. Inspect their condition and nothing. So, sir, there's no denture. And so, based on my inspection, there are no dentures, or broken worn areas. Of the mouth, inspect the surface of the tongue for position, color, and texture. Ask the client to protrude the tongue and move it from side to side. Inspect the tongue movement. So sir, palihog ko ng... So before sir, kayo gusto sa nakay mong tongue sir ha. So matalog na lang sir. Then i-move siya sa side ayon. Ayan na. Tikas. Okay, so the tongue is okay. So let's move to the next procedure. Ask the client to roll the tongue upward and move it from side to side. So i-move siya upward sir. Upward. Ana. Upward. Side to side din sir. Okay, very good sir. Then inspect the base of the tongue from mouth floor and frenulum. Ask the client to place tip of his tongue against the roof of the mouth. So palihog ka ng imong tongue sir kay iyan sa imong mouth asa yung hindi sa imong pinakata. Likod sa imong ipon na. Okay. The client can reach the roof of the mouth. So next is palpate the tongue and floor of the mouth for any nodules, lump, or extra-oriented areas. Use the place gauze grasp to tip the tongue and with the index finger of your other hand, palpate the back of the tongue and its border and baseline. So today we will use the 2x2 gauze. Palagog mo nga sir. This finger, palpate. So the client didn't react to our palpation, which is good, and the client tongue is normal, and when I palpate the border, the client didn't react to our palpation, which is normal, since there are no lesion or any abnormalities. Step is the salivary glands. Inspect the salivary glands ducts for opening for any swelling or redness. Palpate and uvula. Inspect the hard and soft for color, shape, texture, and presence of bony prominence. So, okay. So the client's salivary glands is okay. During my inspection, there's no redness or any swelling, and the uvula. And the uvula is hard and soft, and there are no presence of bony prominence. So let's proceed to the step 22. Ask the client to open mouth wide and tilt the head, then depress the tongue with a tongue blade as the necessary, and use pen light for prominence and visualization. Step number 23. Inspect the uvula for position and mobility while examining the palates. And 24, to observe the uvula, ask the client to say so that the client and the nurse can see it. So sir, kaning halihog ko open o wide imong then tilt gamay sir. Ito na ko imong ton imong tilaok sir. So, sir, ako na siyang isulod sa inyo sir. Okay lang. Say added sir, Okay, very good sir. So the client's uvula and palates is normal, and the whole mouth is okay. So okay ra imong palates and uvula sir, kay pag sig ani mo sir is ni taas imong tilaok, so which is normal sir. And let's move on to the next procedure. To the next procedure, which is the oropharynx and tonsil. Inspect the oropharynx for color and texture. Inspect one side of the teams to avoid electing the gag reflex. To expose one side of the oropharynx, press tongue with a blade against the tongue on the same side about the halfway back, while the client tilts head back and open the mouth wide. Use pen light for illumination if needed. So inspect the tonsil for color, discharge, and size. Elect gag reflexes by pressing the posterior tongue with a tongue blade. Document findings. Sir, suitable na mo suitable yung guys yung tonsil para ma-inspect na kung yung oropharynx and yung tonsil, sir. So kaya kung tilt sa imong sir, open wide. Magamit ko pen light, sir, ha? So, yung second tonsil, sir. So the client the client tonsil is okay, and the color is okay, and during my inspection, I didn't see any abnormalities or problem. And and last one is document the finding. So sir, okay ra overall, okay ra yung mouth, sir. So it's